Today, I'd like to talk about a very common pattern that injures or leads to injury and slow healing of our knee joints. Dr. Feldenkrais spoke about the healthy joint is such that the surfaces of the joint remain parallel to each other. So then the force can transmit and being transmitted up and down the kinetic chain without problems, rather than gapping, where one side gets spread apart and the other part of the joint is grinding and pushing and closing. In our pattern of movement that we're discussing today is misalignment of joint surfaces. Instead of joint surfaces being parallel to each other, gapping starts to form. What I'm doing right now, I'm migrating the knee inward or shifting the knee inward while the foot remains planted, and you see the inside portion of the knee is spreading apart, outside portion is compressing. Take a look at this. A small shift of the knee inward, creating gapping. And this could potentially rip the meniscus, tear or overstretch medial collateral ligament and other structures around the knee joint, and at the same time create excessive loading and scraping on the lateral compartment, on the outside compartment. This is the alignment where the knee is really strong, powerful. You could squat, you could jump, you could run, you could sprint, you could climb, you could do anything you want. Let's take a look, because it's not only the knee joint that plays a role here in this pattern. It's a global pattern that includes all 206 bones of our body. Let's take a closer look at the process of getting up from a chair and sitting back down onto the chair. So, while you get up and sit down, observe what happens with the distance between your knees. Do they remain over your feet and in line with your hip joints? Or do you find yourself that one knee will migrate, or maybe both knees will migrate either outward or inward? The pattern that we're discussing today is when one of the knees, I'll demonstrate it right now, the right knee, will migrate inward in the process of getting up from sitting and then coming back to the chair. So once more, as I'm moving forward, my right knee migrates inward. And this applies not only to getting up from a chair, but jumping, making a jump shot when the foot is out to the side and the knee goes in, landing from a jump with the same kind of alignment, foot to the outside or knee to the inside or both. So, ability to feel the distance between feet, knees, and hips is essential in our way of training for health. Comparing to performing a lunge where the knee goes in, or performing lunge when the knee remains aligned with the foot and aligned with the hip. An interesting idea is that when you injure your knee, it's logical to take weight off of it, right? It makes sense. You don't want to load the leg that has been torn or ruptured. So initially, that pattern works. You unload the leg, but look what happens. When I unload my leg by shifting to the other, my hip joint is migrating toward the inside, and the foot relatively stays on the outside. So watch what happens with alignment of the leg, including the knee, when I shift my weight off. Can you see the crookedness? Look at this again. If I shift my weight over to this side and function like this, and learn to function like this over my left leg, favoring it, my right leg has never a chance to become a good leg, because I'll be loading it while it's crooked. So, potentially using crutches, using canes, using Nordic poles, exercising walking in the water, but learning how to gradually learn to load the leg, but the leg that has the hip, the knee, the foot in line versus the leg, loading the leg, which causes that deviation, that pattern that we're discussing today. Differences of less than a millimeter are extremely significant. First place that I often check is the foot. Is the foot pronating? Is the foot collapsing? Is the inside arch of the right foot present, or does it collapse? Because if it's collapsing, of course it will invite the knee to migrate inward. So foot is the first place. Position of the pelvis. Is pelvis shifted? What happens up the kinetics chain? Our spine. So often, a major side bending to the right may cause the pelvis to shift to the left. Watch what happens. As I'm bending somewhere in the spine to the right, my pelvis shifts to the left, and with it, my knee to foot alignment. Can you see sensation of uprightness, side bending right? Very often you will find one shoulder being lower. Watch, if I side bend here, how the right shoulder hangs lower, and how does that affect my knee? Often you may find the head dipping, tilting to the side. So tilt the head right, watch what happens. So far, we've discussed mainly movements on the frontal plane, the drifting of the knee inward, lateral bending somewhere in the spine. There is one more pattern that I observe that is adding to the perfect storm when it comes to the knee, which is rotations. A tendency of the pelvis to rotate to the left. Watch what happens when I turn my pelvis to the left. Can you see gapping in my right knee? Of course, this kind of twist also will make my right arch of the foot, longitudinal arch of the foot, collapse a little bit. I'm very interested in how this pattern that I've described of side bending in multiple levels of the entire body, twist to the opposite direction of the knee, for how many of you this rings a bell, or you find it familiar, and the impact on your knee and knee recovery in the past. I believe by gaining control over such pattern, making it even tiny little bit better, will make a huge impact on your recovery and your health. I know it does because I see this every day in our clinic with the clients that we work with, but also I know it made a difference on my own recovery from the ACL injury. I hope it was helpful. Onwards and upwards with more learning to come.